trained about immunization during a pandemic like this, it is important to give immunization to the child so that when the condition is full of this disease, at least the child is protected from other diseases. Immunization is the most effective and efficient public health effort in preventing several dangerous diseases. In immunization, there is the concept of herd immunity or group immunity. Immunity this group can only be formed if immunization coverage is high and evenly distributed throughout the region. This concept is proof that the immunization program is very effective as well as efficient because only by targeting vulnerable group will the entire community be protected. By Yuryanto 2020. Even during the COVID-19 pandemic, which has affected most countries, it should not depend the enthusiasm of health workers to continue to echo the importance of immunization and take important steps to ensure that every child who is a vulnerable group is protected from dangerous disease by immunization. Immunization service during the COVID-19 pandemic were carried out according to local government policies based on analysis of the epidemiological situation of the spread of COVID-19, coverage of routine immunization, and the epidemiological situation of PD3I. Health workers are expected to be able to monitor the immunization status of each target in their working area. This is table of vaccine. 1. The monovalent hepatitis B (HB) vaccine should be given the babies immediately after birth before 24 hours of age. First by injection of vitamin K1 at least 30 minutes beforehand. Infant with birth weight less than 2,000 grams. Hepatitis B immunization should be delayed until the age of 1 or more, unless the mother is HBsIg positive. Immediately give HB vaccine and hepatitis B immunoglobulin HBLG at different extremities. Maximum within 7 days after birth. HB immunization is then given with the TWP or DTaP. 2. The zero polio vaccine should be given immediately after birth if born in a health facility. Give BOP0 when the baby comes home or at the first visit. Next, give BOPV or IPV with STWP or DTaP. The IPV vaccine should be given at least 2 times before 1 year of age with DTWP or DTaP. 3. The BCG vaccine should be given immediately after delivery or as soon as possible before the baby is 1 month old. If the age is 3 months or more, BCG is given if the tuberculin test is negative. If a tuberculin test is not available, BCG may be given. If there is rapid local reaction in the first week, a further examination is performed to diagnose tuberculosis. Next, the DPT vaccine can be given from 6 weeks of the age in the form of the DTWP or DTIP vaccine. The DTWP vaccine is given at the age of 2, 3, 4 months or 2, 4, 6 months. The first booster was given at the age of 18 months. The next booster is given at the age of 5 until 7 years or at the class 1B program. Age 7 years or older using TD or TDIP vaccine. The next booster at the age of 10 until 18 years or in the class 5BS program. Booster TD is given every 10 years. Next, the pneumococcal vaccine or PVC is given at the age of 2, 4, 6 months with a booster at the age of 12 until 15 times with a 1-month booster interval after 12 months of age with a distance of 2 months from previous dose. If it hasn't been given at the age of 1-2 years, give PPC 2 times with a minimum distance of 2 months. If it has not been given at the age of 2 until 5 years, PVC 10 is given 2 times with an interval of 2 months. PVC 13 is given 1 time. Next, monovalent rotavirus vaccine given 2 times. The first dose starting at 6 weeks of age, the second dose with an interval of at least 4 weeks. Must be complete at 24 weeks of age. Next, pentavalent rotavirus vaccine is given 3 times. First dose 6 until 12 weeks. Second and third dose at interval of 4 to 10 weeks. Must be complete at 32 weeks of age. Next, influenza vaccine is given from 6 months of age, repeated annually at 6 months of age until 8 years. Of first 2 doses of immunization with interval of at least 4 weeks. Age more than 9 years. First immunization 1 dose. Next, MR or MMR vaccine at 9 months of age. Give the MR vaccine. If you have not received the MR vaccine until the age of 12 months, you can give MMR. At age 10 months of age, give MR or MMR. Age 5 until 7 years, give MR in Class 1 base program or MMR. Next, Japanese encephalitis or GE vaccine is given from the age of 9 months in endemic areas or who will travel to endemic areas. For long-term protection, a booster can be given 1 or 2 years later. Next, varicella vaccine is given from age of 12 until 8 months at the age of 1 until 12 years. 2 doses are given at interval of 6 weeks to 3 months. Age 30 years or older at interval of 4 to 6 weeks. Next, hepatitis A vaccine is given 2 doses starting at the age 1. The second dose is given by 6 months to 12 months later. Next, polysaccharide typhoid vaccine is given from the age of 2 years and repeat every 3 years. Next, human papillomavirus or HPV vaccine is given to girl age 9 until 40 years to time at a distance of 6 until 15 months or in the BS class 5 and 6 program. Age 15 years is given 3 times with a schedule of 0, 1, 6 months. Bivalent vaccine or 0 to 6 months. Quadrivalent vaccine. Next, dengue vaccine is given to children aged 9 until 16 years with a positive dengue symptom, which is proven by history of having been treated with a diagnosis of dengue, or NS1 antigen examination and or positive antigen dengue IgM or IgG serologic test, or proven by positive anti-dengue IgG serology examination. Hepatitis B HB vaccine is given to prevent hepatitis B, which can cause hardening of the liver, which leads to liver failure and liver cancer. BCG immunization is given to prevent tuberculosis. Polio drops are given 4 times at the age of 1 month, 2 months, 3 months, and 4 months to prevent paralysis wilt. Injectable polio immunization is also given once at the age of 4 months, so that immunity is more perfect. Measles immunization is given related to pregnant women, especially in the early period of pregnancy. It can result in miscarriage of babies born with congenital defects such as deafness, cataracts, and congenital heart problems. The DPT-HB or HIV vaccine is given to prevent 6 diseases, namely diphtheria, pertussis, tetanus, hepatitis B, and pneumonia or inflammation of the lungs, and meningitis, inflammation of the lining of the brain caused by HIV infection. So the conclusion of this discussion is it is very important to immunize children age 0 until age 10 years to prevent diseases that are feared to affect the development of children. In any situation, efforts are made to carry out immunization even during the COVID-19 pandemic like today. This is all from me. Wassalamualaikum.